Hi, Jocelyn. I'm going to be your nurse today. I just wanted to ask you a couple questions to see how you're doing and see how you're coping with your new baby. So, how are you feeling today?
I'm feeling pretty good today. A lot better than a few weeks ago.
Okay. Can you tell me more about that? What was going on a few weeks ago?
Well, I think it was like the first week after bringing my baby home, and I don't know, I was just feeling really down and I couldn't figure out why. Like everyone else was so excited to meet the baby and to hang out, and I just kind of just wasn't feeling it at that time.
Yeah. Did you, how, are you still feeling this way, or was it just for a little while?
No, I'm not feeling that way at all anymore. It was just for like maybe a week. I don't know.
Yeah, that's actually not it's a normal thing that mothers go through after they have their baby. We call it postpartum blues, and this is actually like characterized by the length of time that it lasts. So it is actually common for mothers to experience this and for it to last about 5 to 7 days, like you said. Um, and it's just really your body's going through a lot of changes, and one of those changes is your hormone levels are just readjusting to not being pregnant anymore, basically. And part of that is feeling those feelings of sadness and maybe not feeling how you thought about your baby. It's also, I mean, it's a big change. I think this was your first pregnancy, correct?
Correct.
Yeah, so I could imagine you are going through some changes at home, and sometimes um, that's hard for anyone in any situation. So that could definitely result in some feelings of sadness. But I'm glad that you're doing better. That's good to hear that you're feeling a lot better. How have things been at home as far as like adjusting to the change? Do you feel like it's gone smoothly? And are there any things that have been difficult with that transition at home?
I think it was just a lot. Like you said, it was a lot to get used to at first. I mean, it's my first baby, and I've never had to devote so much time for it. And I knew it was going to be a big time commitment, but it was just even more than I was expecting, I guess. And it was a little bit isolating at first because my husband had to go back to work right away. And so it's just been me here alone. So that has been a change that I just had to get used to. And I think it's going a lot better now, getting into a routine.
Yeah, that's good. And that's hard. And I was going to ask you, so it's just you and your husband living at your home. Okay.
Yeah.
Do you feel like you have a good support system with your husband? And have you had any other family that's been able to help out?
Yeah, it definitely, I had to learn to ask for a little bit more help. I think his parents are able to come over during the day so I can have a little bit of a break, take a nap, and then it's been going a lot more smoothly.
That's good. That's really good. Do you feel like you've been getting a good amount of sleep? How have you been doing in that? Because sometimes that sadness, like you're talking about, a lot of times we see it from a lack of sleep as well.
Yeah. I am breastfeeding, so I'm up quite a bit through the night, but other than that, I think I'm sleeping well when I am able
That's
to
good.
sleep.
That's good. Um, I know sometimes after having a baby, it could be hard to continue with any spiritual or cultural practices that you might have normally done. Have you been having any difficulties with that, or are there any specific um, like spiritual concerns that you have with how you've had to adjust after having your baby?
No, I don't think so. I think it, like you said, it was just a little bit of an adjustment. I'm Catholic, so at first I wasn't able to go to Mass. Um, I didn't feel like I was able to go to Mass, but now I feel like I can, and the baby's able to stay home with my husband,
That's
and that's
good.
been really helpful.
That's good. How are you feeling towards your baby? Are things going well? Do you feel like you've bonded well, or has it been difficult? How has that gone for you?
I think it kind of just went along with what we talked about first a little bit. Just it was hard at first, just because I kind of felt off about it, but it definitely has been going really well now. I'm really excited, and
Good.
it's been going great.
That's really good. Do you have like any fears about parenting? Like, is there any specific things that concern you with taking care of the baby, or things that you're worried about?
Um, Not exactly at the moment. I think I've just been trying to educate myself as things come up and call and ask questions when I have them. So I think that's been going okay.
That's good, good. And I hope you know we're here to help you with that, and you can continue to do that. So, um, I mean, it sounds like you're doing well and things are going well with you and your baby. And I'm happy to hear that you're um, not feeling as sad anymore, and you have a good support system at home. Those are all really good and really important things to have at this time. Do you have any other questions for me, or concerns with anything really?
I don't think so, not at this time.
Okay, well, that's great. All right, concludes our psychosocial assessment. Now we are going to go into the debriefing part. So Jocelyn, do you have any tips or things that went well or things that didn't go so well?
I think you're easy to talk to and have a conversation with, which is really helpful as a nurse. Um, I felt like I could open up to you, which was good, especially in this sort of assessment. I think just at the beginning, you just forgot to say what your name was when you were introducing yourself, but that is
Ah,
fine.
yeah,
That's okay.
I did
And
forget that too.
then, um, no, other than that, it was great.
Cool.
What did
I'm
you
trying to
feel?
think of things. I feel like it went pretty well. Sometimes it's hard. I know you're not like a real patient, but I feel like it'd be difficult to get people to open up about some of that stuff, because I feel like it is like some hard questions. And I know just from like previous experiences, like I wouldn't necessarily want to tell like a nurse like about that stuff, but it is important. So
Yeah,
um I guess just uh getting better at like asking the right questions in the right way so that they can open up more and you can get
right.
more information. But yeah, other than that, I think it went well.
Yeah.